Mental health experts in Guyana and abroad are constantly evaluating data to provide preventative efforts in responding to mental disorders. Dr. Elen-ge Denton, a psychologist attached to the Columbia University in the US, is one such expert that has spent the last 10 years meeting with persons affected by mental health and who are living in environments that contribute to mental health risk factors. Her work gives voice to those who silently endure their mental issues but require an outlet to be heard. During an interview with the newsroom on Wednesday at the Arthur Chang Conference Center, where the third annual mental health conference is being held, Dr. Denton said understanding the mechanisms that lead to suicidal thoughts and actions are paramount to developing efficient interventions.
Ultimately, understanding those risk factors to suicide, again, mine are more clinical based, will lead to interventions and hopefully developing of capacity to understand and then prevent suicide risk, particularly among youth, but also extending across the lifespan to older adults.
Dr. Denton is a co-investigator on two of the projects that probes suicide nationally. The objective of the preliminary data collected is to highlight the clinical risk factors such as trauma, separation from parents or loved ones, depression, and providing these affected persons with things they need. The funding for the projects is through the Institute of National Mental Health in the US. Her work is in collaboration with the Child Care Protection Agency, and she has spent time engaging orphanages to understand their individual needs.
It was a matter of listening to the directors and hearing what they said was absent in their running and management of their orphanage, and then giving them what they need. And it was a collaboration, so they also partnered with me and allowed us to interact and speak with the young people as well as the staff there. So I would say the one thing is listening and responding to what those directors and the orphanages' needs are for the youth.
Meanwhile, Alicia Solomon, a social worker attached to the government's mental health unit, said the agency will next year embark on a project to speak directly with persons who are affected by suicide. She said the research will be used to guide national policy on a way forward for the country's mental health program.
To get an in-depth understanding of why this person would have attempted, and what are the circumstances leading up, and what are some of the risk factors. So when we get those data, we're hoping to analyze it so that we can put systems in place so that we can prevent and look at what we are collecting, so we're not assuming anymore. What we're going to be putting out there is based on hard facts that we would have collected from communities, from persons who are actually directly impacted or directly affected by this.
According to Solomon, the conference is timely as it allows persons the opportunity to learn from each other and get the wider society involved in the conversations about mental health disorders. Reporting for the newsroom, Lazina Yearwood.